Okay, so a lot of this is recap at the beginning. So this is really say about what is the menopause. Menopause is a Greek word, meno meaning monthly and pause meaning to stop. So it's the ending of fertility and the ending of our menstrual cycles. During this time, this is when we have changes in our hormonal levels. So this is when estrogen levels plummet, testosterone levels plummet, and this is what gives us those symptoms of menopause that we understand. And fundamentally, this is about a deficiency in hormones. So it's really thinking about what the cause of the problem is. So the cause of the problem is the fact that our ovaries are no longer producing the amount of estrogen and testosterone that they were. So we're having a deficiency in hormones, which is giving us our menopausal symptoms. So the physical effects of those hormone deficiencies are night sweats, hot flushes, anxiety, dry skin, itchy skin, low mood, anxiety, all these things. And again, like I said, the psychological effects, which can really be more significant for people. And just being aware that suicide rates amongst menopausal women is the time, those are the highest rates. So it shows the psychological impact of menopause can have on people. So menopause, when does it start? Well, it can start sort of roughly from sort of like, late 30s, early 40s for some women. And some women can still be having fairly regular menstrual periods up until their mid 50s. But the symptoms of lack of estrogen can start really, on average, in your 40s, mid 40s onwards. And hormone replacement therapy, this is just basically replacing the hormones that your ovaries aren't producing anymore. Thank you. Next slide, please. So what we're talking about today, the natural alternatives to HRT, and we're also talking about the concerns that people have about breast cancer risks associated with HRT as well. So this is really about, the whole point of this is about being able to make informed choices, and they're personal choices for you. So what's right for you might not be right for your best friend. So it's about having the right information so that you can make the right decision for your health on what you believe it is right for you. So decisions not to take HRT need to be based on fact and not hearsay, because, every day I hear people saying that, their neighbour's best friend's sister got breast cancer from taking HRT. But, we can't judge other people, and we certainly don't know all the facts associated with it. So the most important thing is not really to listen to what other people are saying about it, but to do your own research and speak to people that understand about menopause. Read some evidence, read the British Menopause Society, read the NICE guidelines. These are the latest, the most factual information. So any decisions you then make to take or not take HRT are based on the facts, the latest facts, which I understand and I educate on as well. Then it's going to be the right decision for you. And often people say to me, I don't want to be putting those chemicals into my body. Well, it's not that we're putting chemicals into your body, because with HRT, the hormones that we're putting on, the hormones that your body is no longer producing. So probably about 95% of all HRT is based on your own hormones. It's not something that's sort of like manufactured. There we go. It's not something that's manufactured. A very small proportion of HRT is, but the rest of it isn't. So again, that's not something that happens very often. People say that menopause is a natural process. Why on earth would I want to take anything? And it is a natural process. But, 100 years ago, we weren't living as long as we are now. And so we're going to be living a third of our lives postmenopausal, and the lack of estrogen can have a significant impact on our long-term health. So although it is a natural process, the symptoms of menopause can be really, really debilitating for some women. And then the long-term health risks as well associated with the lack of hormones, increased risk of getting fractures, of having heart attacks and strokes as well. So although it is a natural process, there are the risks associated with not having those hormones in our bodies anymore. That wasn't really a case 100 years ago, because we didn't live that long. And that's what I said the other one, years ago, women didn't have HRT, so why should I? And I think that's what that explains, really. It's the fact that life has changed and our lives are very, very different to what they were a long time ago. There's a whole fear factor associated with HRT and breast cancer and a lot of misinformation. Thank you. So the confusion associated with breast cancer and HRT, and where the actual link came from, were two huge studies published in 2002 to 2004. So that was the Women's Health Initiative and the Million Women's Study. So the name in itself realised that these were huge studies. And they were done on women that were given tablet HRT, so oral HRT in America. And they analysed the results of this. They stopped the study of the Women's Health Initiative about halfway through because they suddenly realised that a good proportion of these women were developing breast cancer. So at that point, the study stopped. It then was leaked to the press, and all the information said that HRT gave you breast cancer. It was on all the newspapers. All the doctors stopped prescribing it. Everyone that was taking it couldn't get it anymore and were really frightened, and that fear set in from that point. And then that led to the confusion and the fear amongst health professionals, which is still here now. Now, the problem we've got is that huge study back in 2002, it was such a long time ago now, they've reanalyzed this evidence and they've managed to extrapolate a lot of data from it. And the one thing that they've realised more than anything was that the study was flawed from the beginning, because the study, the women that they used to put on oral HRT were older women, so women in sort of like their early 60s. They gave them the tablet version of HRT, which does not have a good safety profile anyway. And the people that had underlying health conditions, so that smoked, overweight, etc. So they had increased risks of developing cancer regardless anyway, because of their age and their lifestyle and their underlying health issues. So it was flawed at that point. But that wasn't realised until years later as part of the evidence. And as it stands to date now, they've actually found some really, really positive information from these studies. And these, the evidence they got from these massive studies, they're actually publicising these now because they realise there's some very interesting information and show the effectiveness of HRT rather than against it. But that's fundamentally where it all starts from. And the ripple effect was massive, and it's still here now. Health professionals, they've got a real lack of training when it comes to menopause. And I think we all have evidence and all knowledge of this from maybe our own GPs, or certainly people that we've spoken to amongst the health profession, in which there's just very little understanding about menopause, and certainly about the right types of HRT to prescribe, because the NICE guidelines are very clear. And as health professionals, we have guidelines that we can follow to guide us on best practice and best prescribing practice as well. So that's really where the breast cancer fear stemmed from. But again, to take HRT or not is very much a personal choice. Some people just do not want to take it, and that is completely their choice. But it's just about understanding it and understanding where the fear comes from. And then, like I said, any decision you make is the right one for you. Because people fear HRT, and they're worried about menopause, they're worried about their health, but they don't really know which way to turn, and they're really suffering from the symptoms of estrogen deficiency. They've got a really bad quality of life, you know, muscular aches and pains. In fact, the more women I speak to these days, it's what really seems to be a big problem, is the fact that their whole body aches. You feel like you're 90 instead of feeling 40. And, you know, it's stopping you from exercising, it's stopping you from going out and about. You're in constant pain, and your body's aching. So it's understanding about, you know, is the fear legitimate what I've got because I'm not going to take HRT? Or actually, do I need to do a lot more research about it before I completely dismiss this? Because if I could take it and I did take it, then would it improve my quality of life? That's the decision that you need to make. And don't underestimate how improving your quality of life is absolutely essential. Thank you. So the natural alternatives to... Oh, can I have the next slide, please? Can you put the next slide up for me?
Sorry, Diane.
All right.
There we go.
No, I think it's the one before that. I think it's natural. Is it natural alternatives? There we go. Thank you. So the natural alternatives to HRT and the breast cancer risks. As I keep saying, this is very much about you making the right decision for you. Oh, no, sorry. No, can you skip?
I thought we'd already seen that one, Diane.
Sorry.
Have you done this one?
Yes. That's it. Thank you.
Fab. Thank you.
Sorry about that. So HRT, and does it cause breast cancer? This is probably the question that everybody wants to know. First of all, the British Menopause Society have done an awful lot of got a lot of information about this, and this is what I generally say to people. So breast cancer is the most commonest form of cancer in women, and they believe it affects about 23 per 1,000 of the population. So whoever you are, whatever you do, 23 out of 1,000 women will get breast cancer. There's a strong belief that we're born with these cells that can easily change into breast cancer. So about 10% of the breast cancers are genetic, but there are certain things that can increase our risks of it. So what they do believe is that for a small proportion of women, is that these undetected cells that are there, when you start HRT, it can actually just kick-start the development of the cancer. Now, breast cancer is slow growing, so that's the one thing. So when I hear people say, oh, my friend was on HRT for 2 months and it gave her breast cancer, I don't believe that's the case. However, you need to speak to doctors about that. But it's actually slow growing. It's not something that happens immediately. So it's just to be aware that a large proportion of women actually have these cells there that are just waiting, and some can change into cancerous cells and some can't. So many women have undetected breast cancer when they start HRT and they just don't know about it. There is no increased risk of dying from breast cancer compared to placebo. And I think this is really important because everyone fears about getting breast cancer and dying from it. But the evidence is that although there's a risk of developing breast cancer, which in fact is incredibly low, however, there's no increased risk of dying from breast cancer compared to placebo. So that's very, very important. The risks of developing breast cancer are related to age, lifestyle, family history, and chance. So if you think back of the other time, I was talking about the Women's Health Initiative study that was women in their 60s were put on HRT that had lifestyle factors. They were overweight, they smoked, they drank a lot of alcohol. So if we look at the lifestyle and age, the older we are, the greater our chances of developing cancer anyway. If we are unhealthy, we're overweight, this greatly increases our risks of developing breast cancer. And the British Menopause Society actually identified that those 23 out of 1,000 people that will get breast cancer regardless anyway, that of those 23, 24 extra per 1,000 can get breast cancer from being overweight. So being overweight is probably the main risk factor associated with getting breast cancer compared to HRT and the combined pill and things like this. So age and obesity are one of the major factors associated with increasing our risks of developing breast cancer. The estrogen-only HRT gives you no increased risks of developing breast cancer. And remember, young women, so somebody comes to see me or goes to see the doctor, etc., that's, I don't know, 44, having menopausal symptoms, and we put them on HRT, then you've got no increased risk of developing breast cancer until you reach the natural age of menopause. Because, you know, it's not your fault that your ovaries are just not producing as much estrogen from a younger age. So all we're doing is actually giving you, we're just replacing what your ovaries should have been producing. So there are no increased risks with estrogen-only HRT, and also when it's given to younger women as well. It's the progesterone that's a real problem here, and that makes it very difficult. The progesterone is the things that actually can increase your risks of developing breast cancer. So that's why women that have had a hysterectomy or need estrogen only have a decreased risk of developing breast cancer. And the long-term use of HRT is associated, or the long-term use of some HRT was associated with a small risk. But this is what's really important, because there are new studies coming out every month or so. I'm reading another study, and the latest is they're saying that there's a small risk of developing breast cancer from taking HRT. However, this risk is not statistically significant, and that's so important, because although there might be an increased risk, actually the evidence, these double-blind randomized control studies, which are the absolute gold standard of research studies, have said that that's not statistically significant. So the risks are so small that I mention it to people when I'm prescribing it, because I think it's important that we make the right decision for us, but the evidence is there. And so that sort of like, hopefully that helps people make the decisions and understand about the links associated with breast cancer. And I think a lot of it is to do with the fact that, particularly being overweight, we carry more fat cells, so your adipose tissue, and the adipose tissue creates like a different hormonal reaction, and it's the fat changes into testosterone, that changes into estrogen. And it can cause these different reactions within the body that causes not only increased risk of breast cancer, but also like metabolic syndrome as well. So your bloods will be increased risk of heart disease, storage of internal fats and things like this. So it's really quite complicated, but hopefully I've just given you some understanding about what the breast cancer risks are associated with HRT. Thank you. Can you put the next slide up, please?
I already have. Sorry, Diane, I'm not sure if there's a delay then my end.
That's all right. Thank you, Tammy. Okay, so prescribable alternatives. So people don't want HRT. They go to your GP with your menopausal symptoms. These are sort of your options, really. So most prescribable alternatives, and there are quite a few of them, they can reduce the vasomotor, so that's your hot flushes and your night sweats kind of symptoms, and some improved mood and well-being. The most commonly prescribed ones are the antidepressant ones, that the SSRIs, so that's your selective serotonin reuptake inhibitors, quite a mouthful. Your common ones, most people have heard of these, citalopram, sertraline and fluoxetine. But the results and the evidence with this is really quite mixed. They help some women, but they don't help others. And the long-term trials show that there was no improvement, no benefit for improving low mood in menopause when you take these types of antidepressants. Because again, it's sort of like realizing that the root cause of this is more than likely due to a deficiency in estrogen rather than anything else. But they can help with other things. Some long-term trials show no benefit from improving low mood. The side effects of antidepressants, as we know, dizziness, nausea, and low libido. Well, low libido and dizziness can be common symptoms in menopause as well. And so it's thinking, okay, well, is taking this antidepressant going to be more beneficial for me? But the side effects are there. Are the side effects short-lived? Are they going to be long-term? And it's really about deciding what you want to do with it. I can't see the last one because I've got something on my screen.
It says some can't be taken with tamoxifen.
Thank you. Yeah, some antidepressant medications can't be taken with some cancer treatment medications. So just the last one there about the venlafaxine. Out of all the antidepressant medication, the venlafaxine seems to be the one medication that's most effective in relieving menopausal symptoms. So thank you. So the natural alternatives. Well, there's a lot of information about this, and I've actually read quite a lot around these because it's very interesting. I think the first thing that we need to look at is stress. So cortisol. Cortisol has an awful lot to answer for, and that is the major player, if not the player, when it comes to regulating all our other hormones. If we can't reduce our stress levels, it will have a significant impact on everything else. So by reducing your cortisol and reducing your stress will significantly improve your symptoms and your emotional health and well-being. So I can't underestimate that enough. Talking to like-minded women is really important. You know how we like to go and have a moan to people that just get us, that understand us, whether it's best friends or colleagues. We like to have a little bit of a 5-minute rant, a 5-minute moan, and we generally feel better afterwards. And we don't really know why. Talking to like-minded people, like-minded women, makes us feel better, but it does. And the evidence is that it reduces our cortisol and it increases our oxytocin. So oxytocin is the hormone. It's a love hormone, the bonding hormone. So when we talk to people that understand us, we feel this connection with them, and it just makes us feel better. So it is good to talk, as they say. And it actually has some really good beneficial effects to us. So, you know, don't underestimate the importance of talking to people that understand us. So what are our contributing factors? So what else can we look at? Well, work can affect our situations, relationships. And it's thinking about how we can address these, because, you know, if our working relationships are bad, our home relationships aren't very good, we're in an unhealthy relationship, we're struggling at work with our symptoms, we've got nobody to talk to, no support, we're experiencing these menopausal symptoms. We need to look at all of this, because these are the things that can be addressed and can make a significant improvement of reducing our stress hormones and improving our mental health. So a healthy lifestyle. So yes, I mean, this goes into play here with what I've been talking about reducing your risk factors, but improving your mental health, exercise, diet, you know, and doing things like, you know, going for walks, having time out, listening to music that you want to. All this, it creates a positive mental attitude, which really has a good benefit on our improving our symptoms. So herbal supplements. Now, when I wrote this a few weeks ago, this was based on the latest evidence. But I just wanted to say, yesterday I received the latest journal from the British Menopause Society, and they're talking about herbal supplements. Now, as a rule, herbal supplements are not effective because there's not enough evidence to say that they are helpful. So it's this big sort of like, you know, chicken or the egg situation, because there's not enough evidence out there to support the use of them. But some women do say that herbal medications do improve their symptoms. But just as a note here, in the latest journal from the British Menopause Society that, like I said, arrived yesterday, it said that there are significant recommendations for black cohosh in a new analysis. And it just says here that black cohosh has plenty of scientific support for its benefits in treating the symptoms of menopause. So they have found that black cohosh is significantly superior for treating the psychological and the mental health issues associated with menopausal symptoms. So although we don't have an awful lot of evidence about it, black cohosh has always been the one that it's even written in the NICE guidelines in 2015 that possibly can help support women. Although, again, it has to be with caution because they are food supplements, they're not medications, and there isn't the safety and there isn't the data that's there. But that this article just shows that they are looking into it and they are realising that there could be something in this. So again, like I said, it's just food for thought, really. It's quite interesting. But on the whole, as health professionals, we really don't, there's an awful lot of implications with taking supplements and herbs when it comes to normal drug interactions, and we don't understand them particularly well, although we can look them up in the drug formularies. They'll give us a guide. I generally don't advise people to take herbal supplements. Vitamins, minerals, etc. That's very different to taking herbal medications, because I'm not practiced in herbal medications, and I would advise that if you're going to take herbal medicines, that you seek the support of a traditional herbal practitioner, so they are highly qualified. They understand the drug interactions between normal medications and herbal medications as well. But that about black cohosh, I think, is quite interesting. So yeah, we just got to see what happens in the future. And you know, the natural alternatives, it's about improving your overall health. But there are other things that you can do as well. I mean, the cognitive behavioural therapy is recognised by the British Menopause Society as a helpful alternative for HRT in alleviating menopausal symptoms. Thank you.
I think there's definitely a delay, isn't there, Diane?
The gremlins are out. I haven't got anything yet.
Okay, I'll just go back one and forward one and just... Do you see it now? Fab.
Thank you very much. So dietary and herbal supplements, and this is from the British Menopause Society. Though this is evidence that they discuss in their information. So phytoestrogens. Most people have heard of phytoestrogens. These are the plant-based foods that have similar effects to our own natural estrogens, and these are the isoflavones and the ligands found in soya, beans, and red clover. Lots of people take these. I mean, years ago, people used to say, oh, well, you know, people in certain Asian countries that eat a lot of soya products don't have as many menopausal symptoms as us in the West. However, our lifestyles and everything is so different that, you know, you do have to put that into perspective. And the evidence is that there's no beneficial effect compared to placebo. You know, from a health perspective, then, you know, there are good protein foods to have, but to treat menopausal symptoms, there isn't really a lot of data to say, and it says no beneficial effect. Black cohosh, again, I wrote this, and this is based on NICE guidelines saying that things can help, but they were concerned about the safety and the efficacy of black cohosh, certainly with breast cancer and liver disease. But like I said, this new evidence has come out, but yeah, this is very early days, but it's just starting to look promising that this needs to be investigated more, and there may be black cohosh may be something that people can take with guidance. Sage, that's another common herb that people take. Now, I've heard women tell me that it really helps the menopausal symptoms, but again, I don't know how that can work. From, you know, it's the fact that the lack of estrogen is causing the symptoms of menopause, so I don't know how sage would improve that. But again, I'm not practicing herbal medicines, but some people say it helps, but the study and the information published says that it doesn't. St John's wort, there's no evidence that it is effective, and there are huge interactions with other medications. Thank you. We're stuck, Tammy.
I've tried it again. Have you got it now?
No. There we go. Thank you. Okay, so cognitive behavioural therapy, or CBT. So what is it and how does it work? Well, I actually did this course run by the British Menopause Society a couple of months ago, and I actually found it really interesting. And it's about talking through your thoughts and altering how you think and act to improve the physical and your psychological health. So we all have negative thoughts, but what we don't understand is how these negative thoughts produce physical symptoms. And I think it's really important that we do think about how we view situations, how we respond to situations. You know, these are automatic negative thoughts. So we don't really have an awful lot of control about this. You know, we think of something, we think of a problem and immediately think maybe doom and gloom and, oh, I can't possibly do that, or I'm going to fail at doing that. See, I always fail at doing that. So these are automatic negative thoughts. So if nothing else, what CBT does is it makes you realize that these are automatic negative thoughts and how it's impacting upon your psychological and your physical health. So it's raising awareness of how this impacts upon our health. And it's about changing how we think. And that through CBT, it's about reducing the vasomotor, that's your hot flushes and night sweats. It's about reducing these symptoms and improving your well-being by going through this pattern of thinking. Changing the pattern that you think leads to changes in action. And it's altering how you deal with situations as well. And it's about helping alleviate low mood and depression as well, which is what CBT can do. But the course that I did, which was run by the British Menopause Society, was about reducing hot flushes and night sweats with people that can't take or don't want to take HRT and want to use cognitive behavioural therapy. And these are proper programmes that are organised over a period of like 6 weeks. And it's with group work as well. Can I have the next slide, please?
Any luck?
No.
Sorry, everyone. I'm hoping others can see it potentially, but it's hard to know without feedback. But I've got the right slide on.
Yep.
Yeah.
Thank you. Okay. So cognitive behavioural therapy to improve hot flushes. So again, these are examples of how CBT can help you. So, for example, you've got a thought, and these are your automatic negative thoughts, remember. So, I can't cope with these symptoms. I can't do this. I'm useless. So these are your automatic negative thoughts. You put in this situation, I can't do this. I can't cope with this. I just want to run away. So these feelings, so thinking that you might have a hot flush, these feelings can make you feel very anxious and embarrassed. So imagine you're going to stand up and talk to somebody. I do a presentation at work, for example, and you're having hot flushes on a fairly regular basis. You already got these automatic negative thoughts thinking, I can't do this. I'm getting really anxious. I'm really worried. I'm going to stand up in front of all these people. They're going to forget everything. You then start to increase your anxiety and your embarrassment is increasing as well. Then your physical symptoms kick in. So the hot flushes, so you start to sweat, you're turning red, palpitations, you start to breathe a lot more quickly. So your cortisol, your stress hormones going through the roof, and you're really in a state of complete panic at this point, and it's all starting to fall apart. So what we have to do is to change these automatic negative thoughts, because this is how we change our behaviours. We think about our triggers. Our triggers are that we're standing in front of these people. So instead of thinking these thoughts, thinking, I can't do this, I'm useless, you're going to be standing there thinking, I can do this. I've done this a million times before. I can do this. I'm competent. I know what I'm talking about. So immediately from the thought process are going from negative to positive thoughts. So then you're going to have less feelings of anxiety and embarrassment. You're less likely to get the physical symptoms associated with that anxiety and the hot flush coming on, because you've already nipped it in the bud. So it's about changing behaviours, but you can only change behaviours once you realise what your automatic thoughts are, those negative thoughts are. And it's about realising then how we can change this. So again, we're now going to be thinking that I can do this. Of course I can do this. I'm experienced and I'm highly competent. So those are your positive thoughts rather than your automatic negative thoughts. So I hope that's just given you a little bit of an idea of how that would work. So it's a case of maybe just writing those headings down: thoughts, feelings, physical symptoms and behaviour, and writing down what your automatic negative thoughts would be in that situation, whether it's you're stuck in a traffic jam, whether you're late for work, etc. And just put down how that would feel, and then your behaviour. You'll see how you can then change your behaviour by avoiding your triggers. If you're going to be late for work, and that sounds ridiculous, but, you know, turn up on time, be more prepared. Think about controlled breathing. So controlled breathing is the fact that you are becoming mindful of your breathing, and you're calming that down, and you're taking your mind away from all these awful negative automatic thoughts, and you're concentrating on your breathing. And that's how you then reduce your cortisol, because your stress is then being reduced and you're able to cope a bit better. Thank you. So improving overall health and well-being. So what I've just said a moment ago about just sort of like being thoughtful and thinking about what you're doing, this is about being mindful. So mindfulness, I actually did a talk on this to a group of about 100 people. Thought, how can I demonstrate mindfulness in like 4 minutes? And what I did is I got everybody to stare at their shoe. So it was a big auditorium, and I got everybody to stare at their shoe. So being mindful was I got people to describe what they could see, and I guided them through this. So I looked at my shoe. I said about the colour, about the texture, how it made your foot feel, to observe any scratches or blemishes on your shoe. And I did this for maybe 2 or 3 minutes, and I can actually feel my own stress levels being reduced. So and everybody was like, really, oh gosh, that was really interesting. I could really see how that would work. So that was something really, really ridiculous about staring at your shoe. But it's about being mindful. It's about being in the moment. It's about stopping to think about all these crazy negative things and homing on something that's more positive by concentrating fully and totally on one particular thing. That could be staring at a mug, staring at some flowers, walking in the countryside, smelling the air, and really, really zoning into the here and the now. They will reduce your cortisol. There's a huge amount more to mindfulness than that, but that's just a little bit of an idea of how it can help reduce your cortisol levels. Yoga, again, fascinating. You know, again, it's about being mindful and concentrating on what you're doing. And many people really, really feel that the breathing exercises, the stretching exercises, and really tuning into your body. Again, you're not thinking of all these awful negative thoughts. You're completely tuning into yourself at that particular time. Massage, I think it's wonderful. We all like to be touched, and again, this releases our own oxytocin levels. So when we're having a massage, we book in, we can't wait to go. We have a massage by somebody, it's calming, it's relaxing. We tend to just give ourselves over to this person that's going to work wonders on us. So we are becoming more relaxed, our cortisol levels reduce, and our oxytocin's increasing. And most people just fall off to sleep very easily with massage. Aerobic exercises, again, they can reduce some of your symptoms, but they improve your mental well-being. You know, it's a case of we just feel you've got to run or walk and get out of breath just to help get rid of all that built-up tension and anxiety. And also exercise can significantly reduce your risks of getting breast cancer as well. You know, I was talking about those 23 out of 1,000 people can develop breast cancer. Well, by doing regular exercise, so that's 30 minutes 5 times a week, you can significantly reduce your risks of getting breast cancer as well. So exercise is really, really important. So for our mental health, but also our risk factors as well. Seek support from medically qualified and professional accredited people. So important. Lots and lots of people that claim that they can help support you and give you this and do this for you. They've got absolutely no medical or menopausal training whatsoever. So just please be very careful who you seek support from, and make sure that they are who they say they are and they are registered. So people can support you at work. So that's your wellbeing teams, occupational health, HR. your managers, colleagues, etc. But of course, always remember to talk to your GP as well. Thank you. So just to recap then, we've discussed about the breast cancer fears and the links associated with HRT, and how much a lot of this is about your own personal decision making, and also your own health history and your own lifestyle, and how they can impact by increasing your own risk factors. HRT and its links with breast cancer we've talked about. We've talked about the natural alternatives. The GPs can prescribe you antidepressants. There are some other quite heavy duty medications as well, which wouldn't be first line choice. But again, there's quite a few things your GP can prescribe you as an alternative to HRT. There are over-the-counter alternatives, the different herbs that you can buy, and mixed research with them. Generally not that effective, but placebo work for a lot of people as well. So don't underestimate the importance that placebo can actually have for improving your health as well. CBT, again, there's lots of evidence to show that cognitive behavioural therapy can help with reducing hot flushes and night sweats with people, and it's about getting help and support. Thank you. And this is the slide we put on at the end of our presentation. So again, this is saying that we do our twice monthly presentations on different subjects. And the whole point of this is to get us talking, raising awareness, passing on evidence-based information, and getting support from our peers. We're going to be having a question and answer session, which will then go into the Menopause Cafe. Any issues you have, any concerns you have about menopause and your own health at work, please talk to HR, Wellbeing and Occy Health. Next month's topic are going to be the psychological effects of menopause. So I'll be talking about how the lack of hormones can impact on your psychological well-being. That's my website there, borntocare.co.uk. There's the Women's Health Concern website, which is part of the British Menopause Society, nhs.uk/menopause. I can't quite see the last one. Tammy, I don't think you can read the last one.
Yes, of course, Diane. That's the Psychological Wellbeing Hub. So I think if I can just talk a little bit about that, we will be popping the link into the chat box as well. So the Psychological Wellbeing Hub is hosted by Black Country Healthcare. So the link will be coming in shortly. But if you aren't already aware of that, if you do find that you do feel that you need some emotional support, whether that be online, one-to-one, from a CBT approach, then please do make a self-referral into the Wellbeing Hub. What we don't want is for anyone to be experiencing any poor mental health and feeling that they don't have anyone to turn to. So the link will be there. You can make a quite quick and easy self-referral. There are trained counsellors and trained psychologists within the Wellbeing Hub, amongst other things. So if you do feel that you need support, please do reach out. Don't suffer alone.
Thank you.